Hello, everybody, and welcome back to another Nervotics Q&A, the proud leaders in direct current education, sharing the experiences from athletes, coaches, doctors, and other professionals worldwide. Today's conversation is hosted by our CEO, Matt Dell, and he continues to lead the charge in getting this therapy everywhere. Matt, good to see you again, sir.
Jake, great to see you. I love our intro. I'm feeling fantastic. I love that is spot on. We are starting to get this direct current everywhere. It's crazy, blowing up. It's exciting.
It was a goal that I don't think even sometimes even within this company we thought was possible. And now they're coming to us asking us about direct current. So it's exciting to see for sure.
I love it. Yeah. And I'd love to dive into your last week. You had some great meetings and some things, but more importantly, I think we got a phenomenal guest. So let's jump in. They don't want to hear from me
or me.
Definitely. Well, I think they would rather hear from you than me for sure. But more importantly, I think they're, our guests are going to be very excited to hear what Dr. Eddie has to say. So please, why don't you intro our guest today, and then we'll dive right in.
Perfect. Here's a quick video on him, and we'll bring him in shortly. All therapy happens in clinics. Some of it happens where life actually lives. Your home, your gym, your world. Most care asks you to come to it. This one comes to you. No waiting room. No rushed sessions, just focus, just intention. Here, pain isn't ignored, it's understood. Movement isn't guessed, it's analyzed. Goals aren't generic, they're personal. Every session is one-on-one, built around how you move, what you need, and where you want to go. From recovery to performance, from everyday movement to elite preparation, nothing is left to chance. This is therapy without compromise, expert care, advanced techniques, and progress that shows up where it matters most. Please give a warm welcome to Dr. Eddie Uluchyan.
What's up, guys?
How you doing, Dr. Eddie?
Good. Was not expecting a full-on intro video, but appreciate it. That was sick.
I hope I didn't butcher your last name.
No. Said it perfectly. Uluchyan.
Okay, cool.
Oh, very nice. Yeah, but I do have to say, I'm going to jump right in.
Yeah,
Jake, he might have guns like you, my friend.
Yeah, he's in shape. I mean, I kept a lot of those things from his Instagram because I was embarrassed. He made me look bad, so I didn't put those in there.
Definitely not trying to make it look bad. Just trying to practice what I preach.
I love that. That's great. So please share with us a little bit of your background. Where are you from? Tell us our audience a little bit about your background, if you would.
Yeah, absolutely. Born and raised in LA. Always sort of been interested in sports. Always been a part of sports my whole life. So also been very interested in the medical field. Decided on PT pretty early, probably around like my senior year of high school. Just decided to gear everything towards that. Ended up going to USC for my DPT, graduated class of 24. And straight away, I just sort of decided to do my own thing, work with a mentor and get things rolling. So for the past year and a half, I've just been doing concierge-based physical therapy, showing up to people's houses, offices, some gyms, honestly, anywhere that they'll have me. And it's been amazing. It's been definitely a journey, sort of learning how to do everything on your own without sort of going to work somewhere for a year, having guidance of like multiple people, stuff like that. But I typically learn best when I just got like a fire under my butt. So I think I put myself in the best position, and I've definitely been growing in the past year or so.
I love it. So what was it? How did you determine so young that the PT world was what you wanted to do? Was there a moment in maybe a high school sports career or something that led you to this?
Sort of. Just seeing the PT at my local high school, I'm like, this is such a cool job. Get to be around all the athletes. I thought it was super cool, just taping up ankles, being the person that sort of gives like the yes or no if someone's going to go back in and play. If I'm being honest, I sort of wanted to become a surgeon a little bit more than I did a PT, but doing a couple rotations in the hospital, realized this is just not what it is for me. And after I did got my first job as an aide at a physical therapy clinic, saw a couple pro hoopers, and worked with them. I'm like, I feel like I got what it takes to do this. This seems like a much more reasonable daily life for me. And you sort of get that same sort of fulfillment of really helping someone out the same way I guess a surgeon would feel. Maybe there's a little bit more high stakes, but I think, I mean, not that I think, I know now that we're a little bit more involved in the rehabilitative process. So I definitely think it comes back to us tenfold, helping out someone get back to what they need to do for work or just daily living.
Yeah, I love it. I mean, you're probably pissing off all those surgeons now that you're educating and teaching, going, hey, listen, there's a lot of other opportunities, solutions before you go under the knife, unless it's actually, you know, critical. So, well, that's great. So you kind of jump right in, you started working, it sounds like, with some athletes, and, you know, what led to you, you know, give our listeners a little bit, and myself, you know, kind of the concierge role is a unique role. Tell us a little bit about that, and what led you down to that path.
Yeah, definitely is a unique road. It's very, I don't want to call it inconsistent, but you sort of have to put the work in to get consistent income month to month. Same thing with leads. So you really got to put yourself out there. Luckily, I had a very good mentor, Dr. Lev Allen. You can find him on Instagram too. He sort of showed me the path, how he sort of got things done. Saw some talent in me, luckily. So he's been a very big help of just generally for me. But yeah, it's a tough life in the sense of, since you are concierge, you're charging a little bit more premium prices. You do have to be very available for your clients. So this means you could get texts at midnight. You could get texts anytime throughout the day. You're expected to answer, obviously. People's plans are changing. Your plans are changing. You got to be really strict with your schedule and flexible at the same time. People are flying in out of other places, whether it be athletes or people that are touring. So you got to sort of keep an eye out on their schedule as well, and yours. And then you have your regulars, and you're jumping from just, let's say, the highest functional capacity patient when you have like an NBA player, and then you're treating, let's say, a spinal cord injury with a grandma. So you got to be flexible within your treatments and the way your mind works, and just everything A to Z. If you don't really have flexibility, this is a sort of a tough job to maintain.
Yeah, well, that makes a lot of sense. But I can see, just in my short experience in the past 3 years, how so much is changing, and so many more, you know, there's so much more education out there for clients, patients, because before it was kind of like a traditional process. And I think so many people now are starting to take, you know, control and ownership of their own, you know, journeys, their own rehabilitation, their own performances. And I think it's led to probably perfect practices like yours, where people want to be able to, you know, type A's or athletes or pro athletes, you know, they want the white glove treatment, because, you know, let's face it, all you've got, you know, is your health and your fitness and your ability to do what you love, whether that's, you know, put food on the table as an NBA player, or whether it's to play a weekend pickleball tournament just because that's the endorphin high that inspires and motivates you. So I totally get that. And I think having that concierge, you know, obviously is probably great success. And as you start having success with patients and clients, success, let's face it, success begets success. Although if you're that good, some of your clients may not want to tell their friends and family, because they want to make sure that you are accessible for them and only them. But I'm sure that's not the case. Is that pretty accurate on how, you know, you want to be accessible, but at the same time, you want to make sure that you have the client base necessary to support? Is that pretty accurate?
Yeah, definitely. I've been fortunate enough that just working with some of the higher level and higher profile people, referrals go a long way. So do a good job, you just sort of get connected to someone else and to someone else. But it's really important just not to lose sight of who sort of put you on. Respect that. The plan is not to just like not see people anymore and just go higher up an echelon or anything like that. It's always good to stay grounded, do some pro bono work, keep yourself reminded of like why you sort of got into this field. But it is definitely an amazing feeling when you see success both in your patients and in your own practice.
Yeah. So tell us your journey to direct current, how you heard about it, how you got involved with it, how you've integrated it. Because it is, that I would love to hear your background on how you got led into direct current.
Yeah. I feel like everything sort of happened all at once in the sense of I've seen direct current very often. I have a bunch of other people that I work with that use it. So it's not like I'm unfamiliar with it, but I was just thinking to myself, okay, like, do I really have patients that sort of need this? It is an awesome thing to sort of have in my toolbox, but I'm a believer in like as little as required, but sort of whatever's needed. So that was the whole point. Like, it just needs to be needed in my practice, and I'm for sure a believer. So it came to a point where I'm working with basically like a spinal cord ischemia patient who has a lot of difficulty walking, a lot of motor issues in her right lower extremity. And we made huge strides, but sort of hit a big plateau where things were just not moving forward. So luckily I had another person that I work with, asked him to bring his RX-100, and we tried it out with her, did it 2 times, and honestly saw a lot of improvement. So I'm like, okay, I definitely know that one of my patients needs this. And then funny enough, the same week, I have an old client of mine call me and ask me, I want to sort of kick things up a notch. And he had an anterior disc replacement in his cervical spine. So he is sort of like this good buff looking dude, but if you see him try to do a skull crusher, if you see his right chest, like everything has atrophied so much from that surgery. So he's like, is there anything we can do about this? And I'm like, I have an idea. That was RX-100. Use that on him. And then I had another patient that we just could not figure out sort of what was going on. And a lot of my other peers have always been talking about the search method. So I'm like, there's honestly this thing that I'm considering buying. You're actually the 3rd person today or this week that's sort of mentioned something that made this click in my head. We should get it and use the search method. So that was sort of the straw that broke the camel's back. I was like, all right, I need this. I already know that I have 3 people guaranteed that need this done, and I'm sure I could find just more people that I could help benefit with this. And now it's a part of my daily practice and carried around everywhere. Super clutch that it's in just like a little suitcase, can roll it around, can carry it around. So the accessibility of it is awesome. The search method has been sort of like a game changer in the sense of I'm more of a person that I don't want any biases in my work. So I don't want to just get the search and do it. I'll always do like a thorough evaluation, come up with my hypothesis, and then that search method is sort of that verification of like, all right, you're sort of exactly where you want to be, and you found the culprit, not just whatever's affected. So all in all, it's just been an awesome experience with Nervotics. It's only been about 2.5 months, 3 months that I've been using the products, but definitely made some big strides within that time.
Yeah, I love it. I mean, I'm amazed at folks like yourself, that are, I like to call, I smile because you're an artist, right? I mean, what you folks do as a PT or, trying to get people back, into fitness, whether it's a pro athlete or a weekend warrior, as I like to call them, you're an artist, and the search function and being able to do the things that you do, you can't go wrong. So it's exciting to hear, especially somebody like you. I didn't realize how long you've been using it, but 2.5 months to see those success. We see it all the time. Jake, I love it every time we talk to someone like yourself, because it's a constant common theme. It's like, okay, this is great. The other word that you mentioned that I love is culprit, right? Mm-hmm. Which is that culprit word is a critical word in rehabilitation, because the culprit, and Jake could dive in on this, is, the pain is the pain. The culprit is what's causing that pain. And that's probably the biggest thing that most people learn. And I think it's probably the best kind of kept secret and the most challenging thing to overcome mentally for most people is my knee hurts, my shoulder hurts, my foot hurts. And when you use the word culprit, I love it. So that's what direct current does. So, both Jake and Dr. Ed, I'd love to kind of try to dumb it down if you could. So for the general audience that's watching, what do you mean by that culprit?
Yeah. For instance, if someone's having, let's say, arm pain or any leg pain, I am not just going to jump to the source of, like how you said it, I have pain in my knee. It's like, all right, let's get a little bit more specific. Where are you feeling it? Above the kneecap, below the kneecap, above the kneecap, around the muscle? What does it feel like? Is it numbness? Is it tingling? Is it actual pain? All these questions are sort of gearing up to finding who that culprit is. There's going to be different symptoms if someone's had, let's say, a quad tear or a sprain or a strain, or if this is coming from the lumbar spine and it's just sort of like a radiculopathy, it's a nerve issue, and it's causing symptoms in a different area. So there's other ways to look at it too, in the sense of some people are having ankle pain, but it's improper knee dynamics when they're moving that are causing the pain in the ankle. So there's always different ways of treating things. I've had patients that I've treated their lumbar stenosis by working on their ankles instead of their back. It's more of a gait mechanic that's the problem. And people are sort of confused. They're like, I don't get it. I called you here for back pain, but you're working on my ankle. And I'm like, this is why you sort of called me. Let me do what I do. And if you don't see any benefits in like the next week or so, we can call it quits. It's no problem. But I'm not going to be like everyone else, because you've already told me that you've seen like 4 PTs and no one's helped. No one's looked at your ankle, have they? I don't think so. I see this. If we change this, we should get better. So my mind is always looking for the culprit, not just let me go to where your symptoms are at and aggravate it even more.
Yeah, I think it's just so, the body is so unbelievably complex and so difficult to understand. And it is, unbelievable that what direct current has done to kind of jumpstart or get that neurological jumpstart in some of those, areas that maybe there's been compensation or whatever. But I think it's the biggest challenge is, and I live this world, but I think the biggest challenge is knowing that how much the body is connected, but at the same time, trying to find that needle in the haystack, if you will, because I've got knee pain, and you've mentioned it. I've gone and saw, 5 different PTs and nothing worked. I've done this, I've done that. And when you have those answers, you start realizing, because it is a complex, scenario. And Jake, your thoughts on that, because that is it's amazing what this, what direct current can do and how to solve some of those compensations.
Yeah. And I think Dr. Eddie said it beautifully. There's the old school way was, I think, chasing the pain. And, that's the easy answer for a patient, because that's what they want you to do. Oh, my low back hurts, so I want you to work directly on where the pain is at. But the machine keeps you honest. And I love that Eddie is using the search for that reason, where he's taking his craft of what he knows. I mean, it's artistry for sure, because, he learns how the body moves, but there's so many other components that go into it, where it's all this chain reaction of events. And the machine is able to help pull some of that out, where it checks Dr. Eddie as well on saying, hey, are you thinking on the right lines? Is it over here and here, or is it over here? And this machine will help kind of detect that, and kind of keeps him in check as well. And this is paramount for our device when somebody like Dr. Eddie gets their hands on it, because he's already adopting the philosophy that we always say: we don't chase the symptom. We were trying to detect the problem, or the way Dr. Eddie said it even better, the culprit. And, when somebody like Dr. Eddie gets their hands on it, he's already used to trying to find the culprit. This is just going to be another tool that helps him do that, which is why he's already successful in it in the last couple of months. So I'm excited to see where your career goes with this.
I appreciate that. I appreciate that.
So for those that don't know, and I'd love to get both Dr. Eddie and Jake to chime in, what does that mean? What are you talking about, search? And how does this thing work, and why does it, when you're doing the search function, what is that? What's it doing, and why does that matter?
Yeah. So correct me if I'm wrong, because again, I've only been using this for about 2 months, but We typically start with putting one of the leads on sort of healthy tissue, and then using the other lead with sort of like a wet sponge to move around on different types of tissue, and we're comparing the amount of stimulus on one end to the other stimulus on the other end that's on healthy tissue. And we could sort of gauge by that if there is less neural input or any tissue damage or neural damage to that specific location that we're on. And by sort of traveling to different points in the body, we could see which one fired up the most, and then vice versa, place a lead right over there and sort of do the same thing on the other side, so that we could find the two hot spots, so that we could just sort of actually attack the damaged or in need areas, instead of just putting it in a general region and doing the same exercise as you would with like any other regular current.
You know, Dr. Eddie, that's pretty good for a couple of months. The search is it's a finesse game, and to be able to explain it that way, as short term as you've been using this, is pretty impressive. I'm going to give the kind of the dumbed down version, the one I had to learn from, or the one I think I've learned best from. But that's perfectly said. What I usually talk about is, you know, the reason why this machine is able to kind of pull out some of that dysfunction, for lack of a better term, of what it is, because some of it's theoretical. We have a hypothesis of how it works, but what we have learned is that your body contracts between 2 and 30 times per second, depending on, you know, what we're talking about. If it's fast with twitch, you're probably seeing 25 to 30 times per second, but you're searching at 500 times per second. So when it's going over healthy muscle, as Dr. Eddie was talking about, you're going to feel that traditional pins and needles feeling, and it's relatively tolerable and comfortable, you know, to the patient. But when it goes over something that's just not used to absorbing force, perhaps it's you know, Matt, you talked about it, you know, someone's going in through compensations, and perhaps some of these muscle spindles go dormant. When 500 contractions goes over something that's not used to absorbing that force, it reacts differently. Sometimes it's really intense. Sometimes it seems like discomfort to the patient. Now, mind you, you're not putting them through pain, but it triggers in their mind as being so uncomfortable that they want you to take it off. We deem that as a hot spot. That's a place that we want to anchor a pad to wake it up. I'm not a mechanic, but I always use Dr. Sam Battaglia out of Chicago. His illustration, he talks about a car. If you remove a few lug nuts and you go 5 miles an hour, you probably aren't going to notice a difference. But as soon as you go into the highway and you're going, you know, 110 miles an hour, if you're driving with someone like Matt Dell in his fancy sports car, you're going to feel it rattle a little bit. That's exactly what this machine is kind of replicating, is something like that.
Yeah, it's great analogies. I got to say, Dr. Eddie, I was impressed. I think, you know, I thought Jake was smart until you gave your analogy of that. So no, that's solid. I think, you know, we've seen this, you know, I mean, you can get, you know, before everything was a search, right? Before anybody started using it, we've gotten so comfortable now because of the expertise and knowledge. We kind of know when and where and how to place pads, but we also always say that may only be 80-90% of the time. If you're not getting the success, that's when you absolutely have to go get searched. You have to get searched, because, you know, there's I mean, I don't hear of too many occasions where direct current hasn't been able to help speed recovery, help performance, and, you know, get through. But those compensations are critical, and I think that search function is absolutely a game changer for, you know, those cases where you're not getting the results. And I think that's, you know, it sounds like you're diving all into it. I do have to ask, because I'm lazy and I love the foot bath. I think it's the greatest invention of this direct current. I've got to ask, are you, you know, do you use the foot bath? Are you familiar with it?
Yeah.
What are your thoughts on, you know, the foot bath with the direct current?
I think it's pretty awesome. I have patients that just have like poor circulation in their legs, so time to time we'll throw that on just to get as much current flowing through there. Some low-level patients that can't really do much, again, we'll do the same thing. I also take care of a bunch of artists and DJs and stuff like that, so they're flying around a lot and they're on their feet a lot, and then right now, sort of run clubs are like the it thing to do. So a lot of these guys are dealing with like plantar fasciitis, things like that. And I feel like every person in rehab sort of hates that word plantar fasciitis. It's just, okay, is it the bone sitting on the fascia that's causing inflammation? Is it tight fascia itself? Is it the plantar flexors that are tight? Is it bony morphology that's messing things up? So having like the ability to do the foot bath, it's easy to sort of add it along to your practice and have it sort of be like a passive thing where the person's just sort of chilling, doing some ankle mobility drills and things like that. And I typically get really good feedback from it, so I continue to use it. And yeah, I think it's another awesome sort of new thing for patients to experience. It's not often that your PT comes to your house and sort of puts some leads on your foot and goes like, stick them in the water, just chill out for like 10, 15 minutes. So it's definitely a new modality.
Yeah, I tell anybody that buys either our over the counter or that has the, goes into a clinic. I mean, it's if you're not doing that, you're not taking full advantage of the technology for sure. It's too easy, right, Jake?
Oh my goodness. And you know what, if our CEO Matt Dell is saying he likes it, that says a lot, because he's very, very skeptical on things. And I think that's a good thing, especially for our
you should be. Yeah.
And he truly does believe in the foot bath. And last time I was there, I saw him. He has it all set up where he makes it as easy as possible. I don't know if you still do this, Matt.
Absolutely. I lent out my device. And so now it's like, I should have did my foot bath yesterday. Then I'm like, now I got to get the tub back and the leads going, and I live on it. So it's all about ease, but you guys are way more energetic. I mean, just watching that intro video, carrying the tables and all that stuff as a concierge, no wonder why you got those guns.
Yeah, I didn't share half of it. You should see. You have to check his Instagram out. He's.
I'm gonna have to check. Speaking of, how can we, get to your Instagram? I got to go check out some of the other footage. So, how can people, our audience, follow you, learn more if they're looking for a concierge for treatment? How can they track you down?
Yeah, so my Instagram handle is @DrEddieU, as you can see down below. And then there's a link to my website over there as well that you could find. But you could always just shoot me a DM, any type of communication. I should also have my email on there as well in the contact area on Instagram. But DM usually works the best. Just get to things right away. I feel like Instagram right now is just the easiest form of communication for everybody. So you can check out some of my posts. Some things are just for entertainment. Some things are a little bit more educational. But more content to come, definitely, and especially some stuff with nervotics.
Cool. I love it. Yeah. Well, I wish I was. I'm one of the old dinosaurs, so I'm still trying to learn this Instagram and all this stuff. I mean, I when I got on Facebook, I thought that was the greatest invention, and I think that's dinosaur stuff, right? That was to show family photos, and now it's a whole different world. But Dr. Eddie, I mean, great insight. Love what you're doing. So glad that you've integrated direct current nervotics into your practice, and blown away by your knowledge after just a couple of months. I mean, it's awesome to hear you as an artist, how you've integrated. So can't thank you enough
so much.
Time.
I appreciate it. I thank you guys for having me.
It's been great.
Dr. Eddie, thank you for your time.
Of course.
Thanks for the time, and sit backstage, let us wrap it up, and we'll talk here in a few seconds.
Yeah, sounds good.
Perfect.
Wow, 2.5 months and he's already this knowledgeable.
I knew he was smart, but it's always good to put a face to it. And I'm excited for him because he's got some cool stuff already going on in his company. So I can only imagine how much he's going to grow.
Yeah, Jake, I'm loving this stuff. It's going everywhere. It is absolutely crazy. And I know you just had an unbelievable experience with your trip last week. So
we did. So cool. Yeah, we're getting a bigger footprint in the MLB, and that's good to see. I know you've seen it come a long way, and a lot of credit to where this direction has gone from 2.5 years ago. It's just exciting to see it start to come into play.
I love it. Well, Jake, have a wonderful afternoon. Another great show. Glad we were able to get Dr. Eddie on today.
Good to see you again, Matt. And
right.
Everybody else, if you like to learn more about our technology, our training resources, or how to get involved, you can always visit us at nervotics.com. That's NERVEOTX.com. Until next time, thank you, everybody, for joining in with us.
Take care.